According to the Zimbabwe National Cancer Registry, among black women, the most frequently occurring cancer is cervical cancer, accounting for 32.1%, and it is the leading cause of death with 13%. Sadly, over 80% of women get screened while the cancer is at an advanced stage. To address this challenge, PEPFAR is funding VIAC services through the Zimbabwe Association of Church-Related Hospitals, ZACH's health facilities to women living with HIV between the ages of 15 and 49. ZACH is offering VIAC screening and treatment services using the See and Treat approach. To date, over 12,000 women have been screened for cervical cancer. Some of the beneficiaries share their experiences.
Ndakasangana nezvo zvandasingatarisiri. Ndaive nefear, but at the end of the day ndakaswera ndakufanira kuzoti now I'm living a normal life. Ndaamukadzi pane vamwe vakadzi, ndaamukadzi akukwanisa kurarama, ndaane hope kuti ndinokwanisa kurarama ndigozoonao vazukuru vangu ndichiziva kuti handina dambudziko randinaro mukati mechibereko changu.
Zvakandibatsira kuti ndakuziva kuti handina cancer, ndine chirwere chimwe chete chandakurarama nacho. Zvakaoma kurarama nezvirwere zviviri, asi apa ndakuziva kuti ndikurarama nechirwere chimwe chandakatasana nacho. Saka zvakundifadza ndezvekuti ndinogona kuona vazukuru vangu kumberi kundinovi chivimbo ichocho ndichaona vazukuru vangu noti hana chirwere checancer.
Existing treatment methods for the See and Treat strategy include cryotherapy and loop electrosurgical excision procedure (LEEP). Clients suspicious of cancer lesions are referred to the next level of care for biopsies. The likelihood that a woman living with HIV will develop invasive cervical cancer is up to 5 times higher than for a woman who is not living with HIV. The overall risk of HIV acquisition among women is doubled when they have had a human papillomavirus infection. The health facilities offering VIAC services are making efforts to increase VIAC uptake through awareness campaigns by the community peer mentors and educating women as they visit health facilities for other services such as postnatal care, outpatient visits, and HIV clinics as a way to fight HIV-related stigma and discrimination. Community peer mentors share how they are fighting HIV stigma and encouraging women to access VIAC services.
We are targeting HIV positive women, so we are saying all those positive women who came here before they get their services, they are screened for cancer of the cervix.
In fact, ngiqala ngikhulumisa lama-village health worker ayiwa ngani asebenza kakhulu labomama. Umese ukusithi mina mabongomama labana baku-heart ndenhlelo vele sixoxisana ngazo silamalanga okuhlangana. So ngiyabaqoqa ngokubahlanganisa kumbe ngokubanikela emakhaya.
Na tichidzidzisa tinodzidzisa madzimai pamwe chete ku-outpatients department. Tichivaudza kuti gomarara remuromo wechibereko rinobata munhukadzi wese anoita zvebonde. Munhukadzi wese zvichireva kuti vari HIV negative nevari HIV positive. Pavanouya kuno kuvhiaka hatidzoseri vari HIV negative uye hatitauri kuti tirikuda vari HIV positive kutanga kana kuongorora. Tinongotarisa mabhuku. Ini ndinenge ndichiziva kuti bhuku iri rine art number ndo vanhu vandiri kuita sei.
Many a times people ignore the early signs of cancers and only visit the hospital when the cancers would have been at an advanced stage. The high percentages have been attributed to lack of health-seeking behaviors and lack of readily available cancer facilities. Unbeknown to most people, cervical cancer is highly preventable, and when detected early, it is highly treatable and associated with long survival. Despite the advent of COVID-19 pandemic, VIAC services have continued, and health facilities offering VIAC decentralize their services through conducting community outreaches, taking the services to the people. Healthcare providers give details on how they continued VIAC services during the COVID-19 lockdown.
ukuthi isibhedlela sibuye lapha siyakujabulela ngoba kuseduzane qala sasisithi nxa sisiyahlola eSt. Sithole uzothiwa libuye kusasa kumbe uzothiwa amadokotela wakho ahlolayo so sajabula nxa sibona uhlelo lokubuya la isilanda.
This has been delayed due to this COVID pandemic, which has affected almost every program. So we started a bit late, but however, we managed to schedule every facility at least 2 days during this period. 2 days, not per week, per month, because we started end of August. And in terms of numbers, we managed to screen almost around 260 something for the 8 sites.
Most of our clients, they come from hard-to-reach areas, so we felt it's good to bring a service to them since they can't reach the services.
It makes no sense to save a woman's life from HIV and AIDS and only let her die from treatable or preventable cancer. Those were the words of the former United States President George W. Bush in October of 2015. Given the association between cervical cancer and HIV, efforts must be strengthened and a focused and integrated approach to saving women's lives must be taken. The synergies will also address the challenges of unavailability of readily available cancer services to the general public and therefore realize a reduction in cervical cancer morbidity and mortality.